I'm Kellie. I'm a registered nurse. I'm also a yoga instructor. About a week ago, I got a concussion snowboarding, which created whiplash. So I come to see Chris to help me with all of my ailments and making sure I remain mobile.
Let's go on to your back. Might feel a little twitch. Good. Just feel really hot. To the tissues below. Tuck your chin down towards your chest. Let's come onto your side, facing this way. Go ahead and look that way. Great. Flip that side. Cool, let's go into your stomach. Moving forward in the video, we'll be looking at treatment for whiplash, which is a common diagnosis for patients involved in a motor vehicle accident. In this case, it was a snowboarding accident. These injuries typically lead to damage of these structures within the neck, including sprain strain of the muscles and ligaments, injury to the discs, the vertebrae, and the nerves. Symptoms include neck and upper back pain, numbness, tingling in the extremities, headaches, and even lower back pain. The body does a great job of healing itself, so treatment is mainly focused on maintaining pain-free range of motion and inflammation control. In all cases, we do look at imaging like x-rays or MRIs, as well as orthopedic testing to rule out red flags prior to treatment. Most cases will resolve within 3 months on their own. It's an acupuncture needle, so you shouldn't feel anything sharp like a medical needle. You'll feel kind of like a dull, achy sensation. Okay. If you feel that, that's a good thing. So it'll kind of feel like an itch that you can't itch because we're going into the deep spinal vertebrae. Okay. And then I'm gonna hook up a current to it. Have you had like a 10 unit pad? Yes. So it's like that, but just deeper. Okay. And so that doesn't need to be like, I'll turn it up so that you can feel it. It doesn't need to be like aggressive or anything like that, just as long as you're feeling something there. So, are we filming? Mm-hmm. That's actually a good explanation. Yeah. Let's go on to your stomach.
Can I put my hands somewhere? Yeah,
Wherever's
right
most comfortable, yeah. So once those needles are in, we don't want to move. Is that comfortable there?
Mm-hmm.
Okay, cool. So, it should be fine. We're going to go a little bit lower. So we're going to go into C7 and T1. This is just alcohol. The multifidus muscle. So the C7 you can feel is the one that's poking out the most, and then right on top of that is C6. We're gonna go kind of a pinky width out. So that's just the casing of the needle. You'll feel a little poke. Good. And then you might feel a little twitch. Good. How are we doing?
Good.
All right. So we're gonna do 3 more of those. Alright, how we doing?
It's a little dull, but I feel it.
Good. I'm gonna come around to the other side.
Ooh.
A little achy?
Oh, yeah.
Good. So the needles are actually hitting the back of the vertebrae. That's how we know that we are in the multifidus muscle. So these are muscles we can't typically get with soft tissue techniques that use the hands. Perfect. So we can kind of place those directly where we want them. So if all of those feel good, we're going to hook you up with some stem. So we create a circuit between 2 needles so that we can flow away current through there, which kind of feels like a deep muscle massage. This is really effective for me with my neck stuff when I have little flare-ups. It helps me with my extension. So we're going to look at the left side first. I'm going to slowly start turning up the intensity. I want you to just let me know when you start to feel anything there. It'll kind of feel like a flutter or like a heartbeat. Or maybe just like a cramping sensation.
I feel it.
Okay. Is that a good intensity?
Yeah, it's a good intensity.
Okay. More or less right there.
I still feel it. Doesn't feel any worse or better.
Okay. So is that a good spot? You can feel something? Cool. So we'll get the right side going now. So same thing. Just let me know when you start to feel anything there.
I feel it.
Cool. Is that a good spot there? Awesome. And then while we have that going, I'm actually going to get the laser going at the same time. look through the viewer, not the actual light itself. Get to here. Have you had laser before?
No.
Okay. So the only thing that you're going to feel is a little bit of heat. If that heat becomes too much, just let me know.
Okay.
So it's an infrared light. If you were looking at this, we'd have to give you a green pair of glasses that you're face down, so you don't have to worry about anything. The only contraindication is pregnancy around the belly. That's just because we don't have any science experiments on that. And tattoos. So you do have those tattoos that are kind of right there, so we'll just avoid those. The laser cycles between 3 frequencies at 660, 800, 970. And so I think black tattoo removal is around like 1040, so it's pretty close. So if it does hit the ink, it will just feel really hot. Actually lasered my wrist earlier today. And sometimes I'll play around with this, see how it feels. But that's essentially what happens is the ink heats up really quick. So we like these for whiplash injuries, like car accidents, snowboarding accidents. If we're kind of in those first few days, we don't have imaging or x-rays, and we don't feel comfortable doing adjustments, we can at least get some type of therapeutic benefit. Without having to create too much movement there. So, but you had great mobility coming in here, so we were able to do adjustments there. But the two main things that this guy does is it will decrease inflammation pretty immediately. So if that's all we did in a session and we felt relief, that's usually that effect that's happening there. The second effect is speeding up the healing process. So if we have injured tissue or damaged tissue, usually those cells aren't functioning to their full ability. So the infrared light gets into the mitochondria, the powerhouse of the cell, basically soups up that cell to have more energy, so we see sped up healing times. So they originally started using infrared light, class 4 lasers with like surgical incisions, and the rats in the studies that had the laser incisions, actually we found that they had faster healing times with their scar tissue. So it initially started off as like a post-surgical therapeutic benefit where we'd see sped up healing times with scar tissue. I know some practices will use it for like postnatal stretch marks and things like that. In this case, we're trying to get the infrared light to go kind of deeper into the muscles and ligaments that are stretched out.
It does feel hot.
Is that too hot?
A little bit.
Okay. Oh yeah, we were heating up. We're gonna go about 30 more seconds and then we'll be done. You doing okay? So sometimes we can use the lamp, but the area that we're trying to hit is pretty small. And done. So we're also going to pop these needles out. So treatment time is relatively the same time for dry needling reset and laser. So I like to couple them together if we can, save some time. And hang on for 1 second, we're gonna get these out. Alright, you did it. ahead and have you sit up facing me.
Whew. Oh.
If you look up towards the sky, does that feel a little bit easier?
Yeah.
Kind of cleared out.
Whew.
How are we doing?
Good.
Cool. So we're gonna do scraping just to kind of.
Or do you need this still down?
Yeah, I'm gonna
Okay.
keep that there. Yeah, if you want to cut it around. Here, I can kind of hold that there. Cool. So scraping, or gua sha, or instrument assisted. Yeah, that's perfect. Soft tissue mobilization, IASTM, has a lot of names. Basically, it was a nice little reset. Is that too much?
It feels so nice.
Okay, good.
It feels really nice.
Good. Sometimes it feels good, sometimes it tickles, sometimes it doesn't feel good, so I'm glad it feels good.
Feels great.
But basically we have all these little mechanoreceptors that sit in the skin and the fascial tissues that respond to pressure or vibration. So in this case it's a pressure stimulus. When those guys get affected, it sends a little signal to the brain. Brain sends a signal back to the tissues below to basically lengthen or reset. So we'll get kind of a little break in that muscle tension that feels kind of nice.
Feels very
So
nice.
after that dry needling, sometimes we can get some soreness, so we want to do something to take care of the muscles there. All right, and we'll put some tape on there and some icy hot stuff and give you a break. Call it a day. Cool. All right. Cool. Do you want a hair tie?
No.
Okay.
Do I need one?
I'm just gonna be doing a few more things back here.
I can hold it.
Cold spray, 3, 2, 1. This is just alcohol so that tape will stick. Okay. And I'm gonna just do a very simple tape job because of your shirt. We're just gonna two strokes down the back. Yep, and then go ahead and tuck your chin down. We're covering your tattoos. Nobody on that. Actually, I don't have the icy hot stuff, so I think we're good. Yeah. New woman?
Feel great.
Cool. That's good. Thank you.
Thank you. And then down a little bit.
You don't want me to record it?
No.
Can you go lower? Just lower. So this also has, oh, that has everything to do with like my posture at work too. Oh, ow, it feels good though.